That was for my Philly crew representing here.
Woo!
All right. And that clicker is not working. Oh, there's a delay. It's gonna be tricky. We could just play Will Smith all day long. So, this is a hard question to answer. How healthy is your city? And if you want to answer that, I suggest you go visit your emergency room in your city. ERs serve as a barometer of the health of our cities. This is the ER that I work in, and we treat everything from chronic complications from chronic disease like HIV and diabetes to gunshot victims. We also see a lot of bicycle accidents. This is a heat map of bicycle accidents in Philadelphia. And many of these accidents are caused by these trolley tracks that run throughout the city. Bicyclists constantly slip on them, their tires get caught in those grooves, and they get serious injuries from these bicycle accidents. And most of you here probably already know that, poor design leads to poor outcomes. But for us doctors, it's not that obvious. And I think it's not that obvious because we continue to teach our medical students in large lecture halls like this, like we did over 100 years ago. The only difference now is that they are, when I'm lecturing them, they're checking their Facebook on their laptops. So I started a program 2 years ago teaching design thinking and design making to medical students. This is the first design program within a medical school in the country. And we're banking that design can change the way we create the doctor of the 21st century. So unlike that previous picture, this is what our workshops look like. It's very highly interactive. We prototype, we use a lot of Post-it notes, and we partner with folks like you in the audience, ranging from architects and makers and designers. Remember the last time you were in your doctor's office? It probably looks like this. You probably showed up at 9, you probably waited half an hour, you probably waited an hour. The experience probably sucked. And we doctors, we don't really care about what happens to you in that waiting room so much. So, and we ought to change that. We ought to make that experience better. So I teach my medical students to apply design thinking to improve that experience in the hospital. We also partner with architects and we plan and design what a hospital floor might look like. As we said before, the system is designed incorrectly. It's designed on the treatment of disease. Less than 2% of healthcare doctors are for prevention. So we don't really think about how we can prevent this disease. So I challenge our students this semester to develop and design a program that would impact the health of our city in Philadelphia. So we work with the elementary school, or are working with the elementary school in Kensington, and about half of its population lives in poverty. And as we said before, where you live is the biggest determining factor, biggest factor in determining how healthy you are. So these kids, they're probably not going to be healthy as adults. This is a lot right outside of their middle school. There are very few places where they can play safely and access healthy food. So we partnered with local organizations in Philadelphia and also with Maker Health, with Jose Gomez-Marquez and Anna Young, who is a spinoff from MIT. And this program, we are teaching kids to invent physical devices that would improve their health. And this is what it looks like. One project that we have is how can we get kids to eat healthier? How can we get them to exercise more? So we built this DIY fitness tracker. It has accelerometer in it. We 3D printed the cases. We have them out there in our lab. And the advantage of this over a Fitbit is that you can actually get your data from this and look at your data, and the kids could own their data. And they love it. They just are using these around. They're trying to play more, and we think this can impact their exercise activity. This is a geotagging device we built. It has an Arduino, it's a 3D printed case, and this allows kids to tag their locations. So we challenge them, where can you access fresh fruits and vegetables in your neighborhood? So we sent them out with these devices that we made with them. They helped put some of that code in there, and they went out into their neighborhoods and tagged bodegas and grocery stores and farmers markets. And this is what their map looks like. This is an actual map of an 8th grader, and the yellow dots represent healthy food locations. And we want them to start thinking about this at this age. So this is, you've heard the term digital natives. We think these guys are going to be maker natives, right? These guys are going to make physical solutions that help impact health through technology. And we bought some of the physical devices that they made there in our lab that we have outside. We're running it all day long, so we invite you to come and play and tinker with these devices.
Well, thank you, Bon. You give me a little hope about the medical profession, because my experiences, are centered around the lecture. I have a friend, a young friend, a doctor who wrote actually a book called The Upstream Doctors, where he is actually trying to sort of change the way of thinking so that docs are not thinking about downstream. Like, by the time people get to you sick, it's too late because, you could have impacted their life further upstream. So give us some hope here. Like, are you finding that, these young physicians are responding to this and that they get it?
Absolutely. I mean, I think a lot of our students come in idealistic. They want to change the system, but traditionally we beat them down. They come in, we put them in classrooms for 10 hours a day, make them memorize massive amounts of information. We torture them in their third and fourth year where they work like sometimes 80, 100 hours a week. And so we wanted them to have the freedom to fail. They can do that in our workshops and have them think about these real challenges that we face in the healthcare system. Everything from improving that waiting room experience to how can we change the payment system to how can we design a better physical space. We don't have the toolkit to do that. So most of us don't. I practice clinically in the ER. These are issues I face all the time, but never been trained to do that. So this is, they are inspired to change the system through this program that we started 2 years ago.
Okay, so fine for the young docs. And this next question here is, it's more like the fact that, okay, so they're coming into a system which is pretty hidebound. I was one of the funders early on of getting electronic health records kind of spread in Michigan. And, like, come on, guys, the medical profession is finally getting digitalized, like the last 5 years. The medical profession was kind of like, the corner blockbuster, and the rest of the world is Netflix. So how do you like change that culture?
You got to start early. We start in the first year of medical school because the incubation phase for making a doctor is it's like 15 years. 4 years of college, 4 years of medical school, 3 to 5 years of residency, 1 to 3 years of fellowship. It's like 15 years. So the doctors that we're training now, their healthcare landscape is going to look totally different 15 years from now, right? So some people say 80% of our function is going to be replaced by someone or something else. So we're really teaching them to think outside the box, to think creatively. And so you guys in the room are creative. Doctors aren't creative, or you don't think we're creative, but I think creativity is, we all have it in us. A lot of my students want to use the right side of their brain, and we're allowing them to do that.
So the question here is how do you define healthy food, and how do you teach students about nutrition, or do you? And I'd like to add another question. Do you talk to your students about how to talk to their patients about obesity?
So medical students get about 1 to 2 hours of online lectures on nutrition, yet we are the stakeholders in our system to make a difference. It's terrible. And so for the kids that we've been working with, we're asking them what healthy food is, and we're learning from them, because these food desert maps, they're all developed by people like us in the room. But what does the food environment look like from the lens of a 7th grader? It might be that he can get a salad at McDonald's. Is that a healthy food location? I don't know. So we're kind of learning from the kids what that food environment looks like through their eyes, because we think it's important to co-design and co-create with the kids.
And do you talk to them about how to talk about obesity, or do you?
Indirectly, these kids aren't going to want to have a lecture on obesity from me, right? So we kind of inspire them by making these devices, right? So they put together an accelerometer with a microcomputer. We do the case together, we put the code in, and so we're indirectly teaching them to exercise and look at their own data, and we think that's going to impact their obesity. And we want to start with kids, because by the time they're adults, it's too late, right? So we really want to empower kids through making and through technology.
Well, thank you, Bud.
How are you?
Great.
If you could tell us a little bit, I know you were out here and you got a chance to talk with a lot of people, but tell us about what you were doing here, what is Maker Health, and what did you hear from people while you were there?
Maker Health is a spin out of our lab at Mental Devices at MIT. And what we do is we stand up maker programs inside hospitals. We want everybody to make their own medical technology. We wanted to do it in a democratized way, in an affordable way. And we were supporting Jefferson University. They have a program on medical design. And when they said we're going to South by to participate in the South by Southwest Good, we said we can bring prototypes, but also, we really had these amazing conversations about sharing a message that smart devices don't just have to be for the sharper image set. They can be for everybody. And what a lot of people may have not picked up, although in a few conversations, is that a lot of the devices that you saw out there are being applied in hospitals in American care right now. But many of them were actually born out of work that started in places like Nicaragua, and rural Honduras. And we basically imported those lessons, and now they're affecting our own care systems. So it's been an amazing couple of days.
Good, thank you. Anything else you'd like to share with the audience, and then we can maybe turn for a question?
Yeah, absolutely. If anybody has hospitals or community centers or schools and they're interested in getting in help, please get in touch with us. We have kits. We'll send you gear. We'll have conversations with you. It is what we do every day. We love what we do. So we're really excited to meet more people.
Great, I love it. So democratizing
medical technology. Yeah, ask us about our open diagnostic
globalizing it
kits.
too, which is fantastic.
Yeah.
And a lot of open source opportunities.
Ask us about Zika.
Good. Any questions?